Thank you, Chris. Good afternoon, everybody. I just want to start off with some quick numbers here. To date, Northern Light Health has administered 18,775 doses of Pfizer vaccine and 10,600 doses of Moderna vaccine for a total vaccination dosages of 29,375. And that was as of Monday. Yesterday, we added to that total another 943 doses. So that puts us well over 30,000 doses administered by Northern Light Health. We have successfully opened vaccination sites in several communities in Maine, and we're now able to vaccinate thousands of Mainers each week. We're always looking for ways to make this process as convenient and efficient as possible, and we continue to make minor tweaks. Our vaccination events have been smooth, and we've received very positive feedback. On Tuesday, we opened a mass vaccination site at the Cross Insurance Center in Bangor. Our launch was highly successful. Most people were in and out of the building in under 30 minutes, which includes the observation wait time. On the rare occasion there was a line, it was short, and no one had to wait outside. The storm added a layer of complexity to our day, but thanks to our volunteers, shuttle vans, and an FM transmitter that indicated when people should come into the building for their vaccination, everyone was able to get through the entire vaccination process without issue. We had 900 people registered for the vaccination event, and we vaccinated 769 individuals over the age of 70. Those who chose to reschedule due to the weather have vaccine waiting for them on Thursday. Rest assured that even though a small percentage of people rescheduled, no vaccine was wasted. The vaccine that remains from yesterday will be used on Thursday to vaccinate those who are rescheduled. The Pfizer vaccine is good for 5 days after it is thawed, so we are well within that window. Moving forward, all of our Bangor area vaccination events will be held at the Cross Insurance Center. Even if you received your first dose at Eastern Maine Medical Center, your second dose will be administered at the Cross Insurance Center. Here's some helpful hints for anyone coming to one of our vaccination centers. Please arrive a few minutes before your appointment, but know that there is no benefit in coming more than 10 minutes early. We have enough vaccine for everyone who has made an appointment. Have your confirmation number available if at all possible. If you don't have it, don't worry, we'll help you. Please, no food or drink at our vaccination sites. You can expect to spend 15 minutes in the observation area. A limited number of people may need to wait for an entire time of 30 minutes due to medical conditions. A few additional tips specifically for the Cross Insurance Center vaccination site. If you have an appointment to get your vaccine at the Cross Insurance Center, visit northernlighthealth.org and click COVID-19 vaccine for a brief, helpful video about what to expect. It's only a couple of minutes long, and it will show you everything you need to know about the vaccine site and the vaccination process. Tune your radio to 88.1 FM when you arrive to find out your appointment times we're currently serving. Stay in your vehicle until your appointment time is called, and then come into the building for the fastest, most convenient service. And with that, we'll open it up for questions for Paul and I.
Okay, thank you very much, Dr. Jarvis. I do want to make a quick note. I'm going to make a laid out. I apologize for this. David Marino from Bangor Daily News will also be asking questions. We'll put him in after Wells and Flaherty from New Center, Maine. Okay, so again, if you could let me know who you direct your questions to. That way we can make sure we have our camera pointed in the right direction. And the first one to ask their two questions is going to be Charlie from Maine Public. Charlie, just give me a moment to unmute your mic, and then we'll get you asking your questions.
Sure, thanks, Chris, and hi, Dr. Jarvis and Paul.
Hi, Charlie.
So what will with the people who couldn't get vaccinated yesterday, what will the total numbers be of people getting vaccinated? Did you say the next one is Thursday? I guess how will that change what happens on Thursday?
So it's a great question. So Charlie asked, what about those people who had to be rescheduled from Tuesday to Thursday? How will that affect operations? And it really won't affect us much at all. I will tell you that we easily could have vaccinated another 1,000 people yesterday had we had the vaccine. That's how efficient things went, and that's how we had enough staffing for. So again, we had about 770 individuals who were able to be vaccinated from the original 900 that had been scheduled. So that's only a difference of less than 200. So adding that to the 900 people we have scheduled for Thursday will not be a problem for us. So if you had to reschedule yesterday, please make sure that you come to the Cross Insurance Center tomorrow, and we can get you in. We have the vaccine, we have the staff, and we have the capability. That facility actually right now could do about 2,000 people a day, and I was out there this morning looking at ways that we can continue to expand out, and we hope that very shortly we'll have the ability to vaccinate 5,000 people a day. So adding another 200 will not be difficult for us.
Okay, and then when will the next registration be for vaccines? And do you know when the Cross Center will next be open after Thursday for additional vaccinations?
So we've already opened up the schedule for the following week's vaccination. So that has already been out there. I believe most of those slots have already been filled. That is typically what happens. So every Monday at 2 p.m. is when we open up both our phone line and our website to have people register for the following week's vaccine clinics across all of Northern Light Health. I'll also remind people that they can go to the state website, which will show you all vaccine clinics, not just Northern Light Health's vaccine clinics across the state, and how to schedule an appointment. Right now, all of our major vaccine sites across the state are by appointment only. We do understand that there are issues. We had issues with our own site this week where we had a server issue, but it did come back up within a short amount of time, and people were able to get through the registration process. Similarly, the phone lines got tied up because people were calling in. That's good news for us. That means people want the vaccine. We just need the vaccine and be able to give it to you. I can assure you we continue to troubleshoot and make refinements to both our web registration and our telephone line to accommodate more people in a faster time frame. But right now, unfortunately, we just don't have the vaccine to meet the demand. We continue to work with the state on how we can improve upon that.
Okay, thank you for your questions, Charlie. We're going to move now to Brian Sullivan from WABI. Brian, when you're unmuted, feel free to ask your questions.
Okay, thank you. I guess my question would be for either of you, as you set it up and you watched it play out, what did you take away as it did play out? And did you learn anything on the go that might be different from Tuesday to Thursday or down the line?
So that's an excellent question. What lessons did we learn from Tuesday to make improvements for Thursday and further on? I'll say that we were actually down to the nitty-gritty, like which color lanyard should we be using? That's how efficient things went on Tuesday. We were overwhelmed at the process that we put in place, that it worked very well. And so it was very accommodating. Right now we're just troubleshooting areas where we found that there was a little bit of congestion, maybe that we had individuals being vaccinated intermingling with our staff. I don't think anybody that was being vaccinated even were aware that we saw that congestion happening. So there'll be a little bit of flow change probably between now and Thursday, and certainly going forward, just to kind of alleviate some of those congestion sites. But again, the overwhelming majority of individuals were only in the facility for about 30 minutes. I don't know, Paul, do you have any things about staffing?
We learned, I think yesterday was a great example of a collaboration between our employees and community volunteers, getting that group oriented not only in their own jobs, but also in working together, communicating with one another. Worked very, very well. We certainly have opportunity to improve our processes, and we always work on continuous improvement, but a great outcome yesterday, very pleased, and it was clear that, as Dr. Jarvis said, we have the capacity to provide more vaccine when we get the dosage. So that's the very positive message, and it was a very uplifting experience for those working as well as receiving vaccine yesterday.
I guess just the next question would be, with the announcements yesterday and in the last couple of weeks that maybe more vaccine is coming, perhaps 5% more Moderna in the allotment for the state, do you anticipate more availability for vaccinations for people looking to sign up?
Dr. Jarvis might have some more detail on that.
Yeah, so again, we feel we can handle a large amount of vaccine across all of Northern Light Health, but particularly at our large vaccination site at the Cross Insurance Center in Bangor. I have asked for 9,000 dosages for the following week. We shall see how close we will come to that. But it really it really is what the federal government allocates to the state of Maine, and then obviously we need to allocate it across the entire state. I believe that the state of Maine has done a great job in doing so and making sure that that equity is considered when we are distributing vaccine. So it's just a matter of whether or not that will come to us. But again, we can vaccinate a whole lot more people if we just had vaccine.
Okay, thank you for your questions, Brian. I want to move on now to Joe Waller from Portland Press Herald. Joe, again, let us know who you want your questions directed towards, and ask them as soon as you see her unmuted.
Yes, hi. If this could go towards Dr. Jarvis. Thinking about maybe, a couple months down the line, assuming that supply really ramps up and that you are able to do 5,000 a day, whenever that time might be, 2-3 months down the line or whenever that happens. Would it be like you could just walk in that situation, or like what populations would it serve? Could you talk about that a little bit?
So I'll answer the second question first, is which populations. That's determined by the state of Maine. And while Northern Light does have those discussions with the state as to what we think would be best served from a population standpoint, we do not make that determination. Northern Light Health has been clear. We have followed the state guidelines as they have set forth for us, and we have not. We continue to vaccinate anybody that fits into those criteria, whether they are a patient of Northern Light Health or not. We are open to the community. We act as an agent of the state when it comes to vaccine distribution. So that's where the determination will be. As far as whether we'll ever get to a point of it, just allowing walk-in, we can't foresee that in the near future, simply because we just don't have the capacity to be able to do that from a vaccine standpoint. I will say that we had some people who did brave the wintry weather yesterday just to show up to see if we had extra vaccine. I will again say the reason why we make it a scheduled appointment is the 2 vaccines that we currently have, Moderna and Pfizer, are fragile vaccines. They have to be monitored in a very careful manner, and so we only take out the vaccine that we are going to use for that particular day. So it's not that we have vaccine just sitting around waiting to be put in people's arms. We actually carefully do that, and I will say we were so precise that at the end of the day yesterday, we had 2 syringes left at the end of the day as our last 2 people came through the line, and then we were done.
Okay, thank you. And my follow-up question is just simply, so when you do really expand out and are doing, 4,000 or 5,000 shots per day at the Cross Insurance Arena, will you have to do anything different than what you're doing now with staffing? Will you have different types of vaccinators come online, or how will that work?
So I just want to clarify, it's the Cross Insurance Center. The arena is down in Portland. So Cross Insurance Center, we will have to do a little bit of some redesign. We will certainly have to staff more. People who came through the line yesterday did see an area that was in the process of being set up for future vaccination avenues for us. I will say that most of that will be completed by today. That is in the hopes that we get more vaccine. What we had in place on Thursday serves us well. We do feel that on Tuesday, with what we have in place, easily we can do over 1,000, probably closer to 2,000 people a day. With just a little bit more of expansion, we can get out to about 4,000. What we're trying to do is make it so we can keep everybody on the concourse level, that level that when you come through the main entrance of the Cross Insurance Center, that you don't have to go up and down stairs. We do have the ability to use the floor of the center if we need to, but we'd like to not if we can avoid it. And then, of course, that is also one of our alternative care sites should we, unfortunately, need to expand out healthcare capacity. So we do have that dual function going on out there at the Cross Insurance Center, and so we want to keep that available to us. I am pretty confident that we can get 5,000 people a day safely through the upper concourse and do that without anybody having to use stairs or an elevator.
Okay, thank you very much for those questions, Joe. And by the way, to the members of the media, I mute your mics in between questions so there's no inadvertent sound, by the way. Trip over whoever is speaking. So sometimes it gets a little clunky trying to unmute you, but again, I'm trying to preserve the integrity of the recording too. Okay, so next up, we're going to go to WMTW, and that's Mary Kate Mannion. Mary Kate, as soon as you see your mic unmuted, feel free to start asking your questions.
Hi, good afternoon. Thank you for the opportunity. If I could stray a little bit, we're talking a lot about the Pfizer and Moderna vaccine, but if I could ask Dr. Jarvis what your reaction was to the efficacy data released preliminarily on the Johnson & Johnson vaccine and what they could remain.
Yeah, so we're excited about Johnson & Johnson's news. I will caution people that when they look at the efficacy data, it is not apples to apples that we're comparing. Their endpoints were different than the endpoints for the Pfizer and Moderna vaccine. We are confident that the Johnson & Johnson vaccine has the efficacy needed to protect people against severe disease for COVID-19 and hopefully for transmission as well. Unfortunately, right now, I can't, my crystal ball is not in place for me to say when they will get through the final approval process. I still think that's going to be weeks to a month away before they can ramp up production and get vaccine out to us. It will be a welcome addition because it is a vaccine that is more stable and therefore may be able to be given out in a more general use than one of our large-scale vaccination centers. We do know that the state of Maine has been fortunate to get a large supply of Pfizer each week, and so we will continue to work as if Pfizer and Moderna will be the sole vaccines coming into the state, and we will adjust accordingly if and when something else appears on the horizon for us. Right now, we are just focused in on trying to get as many people vaccinated as fast as we can with the supplies that we have.
Absolutely, thank you. And if I may ask another question in a different setting, is Northern Light Health doing anything to participate in genomic sequencing of any COVID-19 to track variants? I'm not sure if that's something that y'all have participated in, sending samples to labs.
So that's a great question. In fact, I had a conversation with Dr. Shaw this morning about that very issue. So the state has already started to do some genomic testing. They have been working with Northern Light Health Lab in order to start doing some genomic testing for us as well. And then we are working on a private enterprise to be able to do some limited genomic testing for some very particular reasons, particularly if we had an outbreak, to see if that outbreak was caused by a different variant. So yes, the state of Maine is doing some variant testing right now, and we will continue to contribute to that process.
Thank you very much for those questions, Mary Kate. We're going to go to Rosalind Flaherty at News Center Maine. And Rosalind, I'll unmute both of you. And when you see you're unmuted, go
Hi, Dr. Jarvis. Can you hear me?
I can, thank you.
Okay. I know you said this before, but I think it's important to reiterate. The people who had to reschedule because of the storm, do they have a dose assigned to them?
That is correct. So when we make a scheduled appointment, we have the vaccine on hand for that scheduled appointment. So if the scheduled appointment was for Tuesday and you rescheduled for Thursday, that vaccine still exists for that scheduled appointment. It's another reason why we are doing things by schedule, so that if something like this should occur, like weather that happens in Maine, that we can ensure that you don't miss your place in line simply because bad weather occurred. And so yes, indeed, those people that had to reschedule from yesterday for tomorrow, we have vaccine for them.
And then how do people go about rescheduling? Do they call? Do they call, or do they get a call themselves?
They need to, so we've asked people that if they had to reschedule, that they called our hotline number, which is readily available, and we can certainly pass that out to the media when this is over, so that they can call that number and get rescheduled. We will try to reach out to some, but again, with volume issues, that becomes difficult for us. It would be better for people to tell us that they needed to reschedule.
Thank you very much for those questions, Rosalind. We're going to go now to David Marino from Bangor Daily News.
Sorry, there was an issue with the muting. I wanted to ask, you mentioned the web portal being down on Monday, shortly after the 2 p.m. start time. Is anything being done to prevent that kind of thing from happening again? And is there any consideration to maybe spread out the availability to prevent the servers from being overwhelmed? That is the availability of vaccination spots.
So I'll answer the second one first. It would not matter if we spread it out. The volume of people that have tried to go to our website or our telephone calls is both encouraging and frustrating at the same time. And even if we space that out, that would not make a change to that. It's good news that people want to get vaccinated and we want to help them. I will say that the issue that happened on Monday was a different issue than we had before. We were actually trying to make some customer service improvements to our website, and as with things that happen like that, it unfortunately caused an error message that made our servers think that something nefarious was going on, and so it shut the server down for protective services. And so we've corrected that. We will continue to work to modify, to make our website user-friendly, but also make sure that it can handle the volume as we go forward. And I put the full faith in both our IS people and our communications team in getting it so that will not be a problem going forward.
And my second question, and thank you so much. You said previously that you want to do daily vaccines eventually based on supply. Why are you choosing to do Tuesdays and Thursdays right now as opposed to doing, less vaccines each day? And down the line, even if there isn't a significant increase in supply, do you think that they would ever prepare to, do daily vaccines, even if the supply isn't there, just prepare to be a daily vaccine clinic that you want to be in the future?
Yeah, so the reason why we chose Tuesdays and Thursdays actually had nothing to do with vaccine supply. It had everything to do with when we made our agreement with the City of Bangor and the Cross Insurance Center for us to take occupancy. And so that's really where the decision came down to, is that because of occupancy, we could do Tuesday and Thursday this week and for next week as well. The reason why we're not doing things spread out more over the week with less doses but more over the week is that it really is a logistical and operations issue. Remember, most of the staff that are there are staff from our hospitals, and we need them to be at work, and so it would be better if we're going to pull people off the line, we'd rather pull them off the line to be able to do as many vaccines as possible in a short amount of time, and so that's what we can do right now. We continue to get tremendous support from our community partners and the people around the community to volunteer and assist us, and I think going forward that will not be an issue. But the reason why we're doing it over a large scale in that period of time is because it's just a more efficient way of doing things, and we showed very clearly yesterday that we can get people through our line very fast. I'll just share with you that about midway through the day, someone asked me, what have we done, about 200 vaccines? And when I told them 500 people had already gone through the line, they couldn't believe it, because at no time was anybody waiting at any of our stations to receive their vaccine. And so it looked like there was nobody in the building. That's how efficient we are, and that's how efficient we want to be going forward, so that people are unaware of how many people we were actually vaccinating. At our high yesterday, we were vaccinating 150 individuals every hour.
Thank you for those questions, David. Dr. Jarvis, WVII has some audio issues, so I have a question from them. And you may have touched on this already, but the question was, it seems like vaccination process is going well except for a lack of supply. What can or is being done to help increase the supply?
So again, unfortunately, we don't have any control over that. The federal government owns all of the vaccine against COVID-19. And so it is their supply, and they work with the states, and then the states work with us. From our standpoint, our relationship with the state works very well. Usually we get contacted sometime midweek to ask what kind of vaccine supply we think we can handle. Like I said, I have not been shy about asking for a lot of vaccine because we know we can handle it. It's not even that we think we can, we know we can. And then it's a process between the state of Maine negotiating with the federal government for what vaccine can come out. I will say if there's one thing that would help me right now besides more vaccine, it would be knowing more than a week in advance as to how much is coming. We have basically schedule our vaccines 1 week at a time, because we will not open up appointments unless we can guarantee we have vaccine. We have seen countless number of issues around the country where clinics have had to be canceled because there has not been vaccine delivered to that particular site. That means those people thought they had a scheduled appointment, and now they have to get back in line at the end of the line of everybody else that's trying to get those vaccines. We will not do that with a Northern Light Health Clinic. If you have an appointment, we have the vaccine for you.
Okay, really quickly, members of the media, I want to point you to the chat window. I believe one of you, I can't remember who asked about the hotline, the vaccination hotline number. We did post it in the chat window for you. I'm going to probably read off 2 more questions for Dr. Jarvis that came in as late asks, and then we'll have to wrap this up. But Dr. Jarvis, this one from Maine Public, a follow-up. Wondering how many people you're expecting to vaccinate during each daily clinic next week?
So I don't have a precise number on that. I will be honest with you. That decision was made Monday afternoon while I was busy trying to ensure that we were open and ready for our Tuesday clinic. And I have not stopped working at the Cross Center until coming here for you guys. But we can try to get those numbers out to you later today. So I apologize for not having them right at the tip of my tongue. I've been a little bit distracted the last 2 days.
Okay, and this will be the last question I think we'll have time for. Brian, I would ask this one for you, but I'm not quite sure it makes a lot of sense to me. Something about the 9,000 ask. Can
Well,
you?
how much? Yeah, the question is, how does the asking for 9,000 next week compare to previous requests that you made for vaccine?
I will say that number is not unique to this week, and I'll leave it at that, Brian.
Thank you.
Okay, thank you all members of the media for attending this virtual press conference. Again, if you'd like a copy, a high-resolution copy of the video, let us know, and we'll make sure to email you the Dropbox link to that later on today. As always, thank you very much for your participation. We certainly appreciate your helping us get out the word about efforts regarding COVID-19. So thank you.
Thank you.
Thank you.